today is, can we understand the exposures that lead to eczema development and flares to get upstream of these negative impacts on children and families and reduce the suffering? We want to start a conversation today that advances progress towards that, and ultimately we want to focus on solutions. I'm happy to introduce Dr. Myles, who's joining us from Washington, D.C. today. Dr. Myles was born and raised in Colorado, completed internal medicine residency at the Ohio State University. He's now the chief of the Epithelial Research Unit, where his group focuses on the microbiome, the immune system, and the environment. Myles is also a member of the GPER Board of Directors.
Thank you guys for having me. Next time, warn me about the windshield factor. Like I said, this is our group at National Institutes of Health, so we're your tax dollars at work. So we focused on the microbiome. As Corey mentioned, there's a big uptick with eczema that really starts on or around 1970 in the United States. And at a rate that, a lot of the research up until this point is focused on genetic predispositions. Genetics cannot possibly generate this kind of population effect at that time. As was hinted before, collating the different things that have been associated with eczema before. So the first ones basically can be lumped into living into an industrialized area. I'm going to point out migrating to the US or the EU from a non-industrialized nation matters if you're under 2. If you're over 6, you can move to any country you want and your rate of eczema doesn't change. So there's something that happens in the early window that dictates your risk. Inside the United States, there is an additional risk for living in an urbanized environment versus a rural environment. Coming out of the back of a car exhaust is the next set. I do want to caution when they talk about what are the types of air pollutants, and cars come up a lot, those are the type of measured air pollutants. Those are the things where somebody collects an air sample, does a chemical analysis for certain things, that doesn't necessarily encompass everything that's in the air pollution. But cars come up a lot as living next to the highway. Wildfires, and then things around remodeling. So painting your house, wearing nylon. Also, patients seem to complain about polyester and spandex. ETS is environmental tobacco smoke. Tobacco makes everything worse, so everybody should stop. I work for the Surgeon General, I'm required to say that. And then things like new floor, paint, furniture. We heard about volatile organic compounds, but again, there's an age cutoff. If you remodel the house before they're 4, the risk goes up. If they're after 4, the risk does not. All right, so we started getting interested in the microbiome based on the Human Microbiome Project, which was done before we came along. But I'm basically coloring in where on the body you find gram-negative organisms and contrasting that with, as we know, the distribution of atopic dermatitis. And so why does the skin bacteria actually matter? What do you need skin bacteria for? So it turns out, for the most part, you need them on your skin to make particular kinds of lipids or oils, whichever term you want. So patients with atopic derm tend to have disease in the areas where you find gram-negative bacteria. Gram-negative bacteria are entirely made out of those kinds of lipids. They help make the lipids. You've probably heard of ceramides, and some topical products will contain that. Those bacteria actually make ceramides and put them on your skin. So my thought was, well, maybe you actually have a problem in the bacteria making the types of lipids you need for skin health. And so we found the gram-negative bacteria. We actually convinced the FDA to let us spray this on children. And so this is an open label trial where we're looking at the clinical outcomes. And you see, for the first 16 weeks, patients were treated, and then we let them go home, didn't treat with anything for 4 to 8 months. And we had a really long washout, not because I'm super patient, but because that's what the patients tell you that they want. They don't want a better topical, they want something that's disease modifying that you use and you don't have to use for the rest of your life. So that's where you can see that they left, and even though they hadn't been treated for 8 months, their improvement was maintained. You can do an analysis to say, where are bacteria still on their skin 8 months later? And indeed they are. That's what this data is showing. It colonizes the skin, and what we think is happening is it continues to provide those lipids long after the treatment is stopped. How it works at the NIH is then the private sector takes over, and they ran the placebo-controlled trial. And unfortunately for them, they sent their commercial endpoint at the end of active treatment, which was not successful. So it was a commercial failure. You'll notice the same exact thing happens during their trial. So in that gray box, 16 to 20, they only did a 1-month washout instead of 8 months like we had. But the second the placebo stopped, the severity of the rash, the extent of the rash, and the itch came right back. But in the treatment group, it was preserved. Every improvement they had, they kept after it was discontinued. Now, I do not think this is the only bacteria that can do this, but it says if there's some environmental pollution that prevents this bacteria from doing its job, that would be bad. All right, so that's what our question is. So we did 2 different databases. So the first one is to look at eczema hotspots. So this is accounting for population and access to care. This is saying where in the country is a disproportionate number of children or adults even going to the doctor for eczema. And so that's on one side, and the other one is the EPA. So the EPA has databases that are not just what gets measured in the air, but this is what gets spewed into the air. This is a collection of all the pollutants that the companies tell the EPA are required to inform them. This is what we put into your air, whether you measured it or not. All right, and so we looked at as many different mathematical models as you would like to entertain yourself with. They all look the exact same. Diisocyanate comes out as the top as the most associated chemical. It is one of the volatile organic compounds, VOC, but it is not picked up by any commercial VOC monitor that you can buy. So you say, well, when did these things come into existence? Because remember, I told you 1970 seems to be the point of the sand. They started to be manufactured in the United States right at 1970. The two most common diisocyanates, you see take off from there. And if you ask, if I wanted to fill my life with diisocyanates, what would I do? You do three things. You would burn fuel through a catalytic converter. It is not a product of gasoline consumption, it is a product of catalytic conversion. Catalytic converters came on the market in 1975. There's only one natural source of isocyanates in the entire world, it's wildfires, depending on the exact plants that are burned. And if you wanted to fill your house with it, you would use paint, polyurethane, you would use nylon, spandex, polyester, wallpaper glue, all those things that people are telling you are associated with increased risk, all of them require diisocyanates for them to manufacture. So if it messed with those bacteria, that would be very concerning. So in short, the healthy strains of Rhosiomonas take nitrogen and fix it into those lipids that I told you that are beneficial. And if the red line you see there is the level of ceramides made by these bacteria, and the higher the dose, you see the line starts to go down, even though the bacteria in black might actually grow a little better. So this is that kind of line where like you either die a hero or live long enough to see yourself become the villain. If they're exposed to isocyanates, they have two choices: they die, or they switch their physiology so that they can survive this exposure. And when they do, they stop making the lipids you need for health. Next. And this is just to show you a visual representation on the left half. The healthy isolates are not really altered by low levels of fumes from polyurethane. Disease-associated isolates love growing in polyurethane fumes. We also looked at the host sides. There's a receptor called TRPA1. Everybody knows these receptors to some extent. They're temperature receptors that get hijacked by natural compounds. So this is the reason why chili peppers taste hot, right? These are those kinds of receptors. TRPA1 is supposed to pick up cold, but it is directly activated by TDI. When it does, it induces itch, rash. It also has, on mice, at least, direct effects on anxiety and depression independent of the itch and rash. In culture, you're going to watch here are itch neurons that we either added TDI or blocked TRPA1, and I bet you can tell the difference. When these are activated, they're sending out itch signals into our culture model. And so if you block this, you can get added benefit in mice. So now you have poisons the bacteria from doing its job, and it directly activates a skin receptor known to generate rash. So then the very last part of it, it might dictate the outcomes of your clinical trials. So I showed you this data already, but this is all after the fact. The company could possibly have known this. They had 15 different sites and 15 different zip codes. So now I can subpopulate to say, did you get better based on which zip code you were at? And what you found is that if you lived in a more polluted environment, the bacteria actually worked better for you. And what we interpret that as is that if your natural bacteria are toxified, replenishing it with good ones would be better for you. If you're living in a pristine environment already, then maybe your issues might be something unrelated to that. And so I'll just leave you with these. We talk a lot about the different factors of eczema: healthy diet, barrier function, the commensals, and staph, and so forth. And really, we feel excited about this because we can connect isocyanates and diisocyanates to all of this. It gives a survival advantage to staph. It'll kill off your healthy bacteria. In other models, it directly induces cytokines, it blocks the barrier function, and has a specific receptor for itch.
I had a question. So we heard about small particulate matter entering the skin through the last two presentations and triggering inflammation and barrier dysfunction. And you talked about the microbiome and the bacteria being disrupted. What is the relative importance of these two things, and how do they work together, and how should we think about that?
Yeah, I think of them as a feedback loop. So you can't, if you screw up one, you're destined to mess up the other one. You know, this comes up a lot. A lot has been made in the microbiome world about Staph aureus, and it undeniably makes the disease worse. But Staph is contagious and eczema is not, so it can't possibly cause a disease. But if you broke the barrier function through PM 2.5 or some other thing, you would expect the microbiome to get thrown off because then you have a pro-inflammatory environment. And basically, you need a healthy microbiome to have a healthy skin. But unhealthy skin cannot foster really the growth of a healthy microbiome, right? And so I think both of those things would basically, it wouldn't matter which one you screwed up first, they're both gonna go down.
You talked about this threshold of like under 2 or under 4. Why do you think that is?
Money's on neurodevelopment. I think what happens is that there's a developmental stage both in the brain, the nervous system, and the immune system. And once it's set, you might be, unfortunately in the wrong direction, but it gives us an opportunity to intervene.
I think it's a really important question though, because we really want to understand what that window is and how to protect it and what we can do in that window to prevent kids from developing these.
You look at pregnancy and those type of exposures, given most of us have our babies and it happens basically right away, like long before they're 2 years suffering and dealing with this, is pregnancy exposure.
The only one I know about was the studies about living near highways. There's a particularly strong risk if you're pregnant right near a highway.
I appreciate the nature of these questions though, because they're very practical, and I think that's what patients and parents want to know about. When we have one question online.
I'm just really curious if this isocyanate, am I saying that correctly, is a VOC similar to formaldehyde that we find in foam mattresses and even formaldehyde in children's pajamas.
Yeah, it is a VOC. It is not measured by any commercial VOC measurement. There's only one detection system. It's about this big. It costs $6,000 and you can only use it for a month. In terms of foam mattresses, you cannot construct a foam mattress without diacetyl. All of them are made of that. And if you Google or go on YouTube to entertain yourself, if you look isocyanates, you'll see all these chemical videos bragging about all the wonderful products made with their chemicals.
So with this assumption, then it would be to avoid all of those products.
I would, if you're particularly if they're under 4, I would not have foam mattresses. I would not have polyester, nylon, or spandex, polyurethane, or reseal anything. If you have some old furniture that's been off-gassing since your grandma, I'm not worried about that. I would not newly paint anything. I would not wallpaper the home. I would not change out the carpet. The foam under all the carpet is made out of isocyanates. And so you rip it up, we're going to aerosolize that. Like I said, we are doing everything we can to validate particular air filters so that you could just pick the right one and maybe run that in the kids' room so that maybe even with the wildfire outdoors, you're collecting the exact chemicals that you need to block.
Thank you.
Great. Thank you, Dr. Myles.